Hey, welcome back. So we heard today about Ontario's new plan to offer COVID booster shots to all people 12 and up over the next few months. The rollout would happen in stages, but in the meantime, we know lots of you have questions about boosters and when and whether you should get them. So we asked infectious diseases specialist Dr. Zain Chagla to join us to help answer some of those. Dr. Chagla, you ready to go?
I'm happy to.
All right, let's do it. This first question's from Anthony, and it's probably the one I've heard the most. Have a listen.
My name is Anthony Warner, and my question, are booster shots even necessary?
Nice, simple one to start. What do you think?
Yeah, so, I mean, it is nuanced, and I think there is likely a need for everyone to get a booster along the lines at some point. You know, the Delta variant, particularly because it escapes immunity a bit more, the fact that, we do know antibody levels do wane over time. Yeah, there's going to be a point where people need a booster. The people that need it now, though, the ones that are being designated are the older people where, those breakthrough infections in 70-year-olds, most of them are still mild, but they're the highest represented group of ones that lead to hospitalization in ICU and obviously outcomes we want to avoid. Indigenous communities where they're at higher medical risk, but also in very remote settings where healthcare is fairly limited. And so, providing as much protection as possible. And again, healthcare workers where there may be a risk of exposure, although, even that group could be delayed a little bit more considering the context. So, I think there is a now need for booster shots in certain groups. There's a coming need for the next few months for people that are more transmission and safety in particular settings. But I wouldn't be surprised if everyone has to take a shot at some point, recognizing that, at some point antibody levels are going to wean. And again, more protection is going to be needed for us to keep up.
Right, because along those lines, I mean, I do wonder, today, the standard by which many people evaluate risk is whether the people they are around are vaccinated. And I can't help but wonder, is the standard approaching, have you been boosted? You know what I'm saying there?
Yeah, I mean, I think to go back, the disease is fundamentally different now in November of 2021 than 2020. With more populations vaccinated, there is a limitation for spread amongst people. It's not perfect, but there is some limitation of spread. We know that unvaccinated people overrepresent cases as compared to vaccinated people. So, there is time, and there are groups where their vaccines are working just as well as they should, where the risk of having a breakthrough infection is low, the risk of having complications is low. A young 20-year-old without any medical conditions is probably fine to wait 6 months, a year, even longer to get their next dose. So, again, this is more optimization of higher risk groups. And then, slowly rolling it out to the population as we start seeing other groups identified that are at higher risk.
Okay, this next question is from Evan.
Hi there, my name is Emmett Young, and I was just curious, is the third booster shot too much? Like, can I get sick from it? Is it safe?
Can you overdose on the vaccine or boosters, as it were?
I mean, so the vaccines last a very short amount of time in the system. What we are seeing, though, with boosters is, as people got their second shot, predominantly they got, more of those mild side effects, fever, feeling a bit lethargic, being off for a day, signs that the immune system is working. So giving a third shot when your immune system is already primed, well, yeah, there is a likelihood you're going to see some of those symptoms again. It doesn't mean that they're dangerous. People may need a day or two off work. And as we do booster campaigns, that's going to have to be part of our thinking about workers that are getting their third dose. But generally, again, the experience from Israel, the experience being shown through Moderna and Pfizer through the clinical trials, the real life experience in the United States now, all of which are seeming like, outside of those risks, we're not seeing many new side effects from boosters and, generally as safe as shot 1 and 2.
Can I ask a really quick follow-up? Would there be any reason not to get a booster from a health standpoint?
Yeah, I mean, so we're using mRNA as boosters. If you had a history of myocarditis or pericarditis on the second dose, which it's more common to see, especially in young men, then a booster would be contraindicated because we could likely see that reaction happen to the third dose. People who had a major anaphylactic reaction to the second dose, should be seen by an allergist in order to evaluate whether or not they could get a third dose. But for the most part, again, the populations that were able to tolerate a second dose appropriately should be able to get a third dose without any hesitations.
Okay, we've got time for one more question. This is from Joanne.
I'm in the right age category, and I am hesitant to get the booster, not because I don't trust it. I took AstraZeneca, and I don't think the booster is an AstraZeneca. So I don't know about mixing them.
What do you think?
Yeah, good question. So yeah, absolutely. Our boosters are going to be mRNA vaccines based on the fact that the efficacy seems a bit higher, plus our supply is here, plus a lower risk of clotting reactions that we saw with AstraZeneca. We have a lot of experience now, months and months of experience giving AstraZeneca and a follow-up dose of an mRNA vaccine. This is the standard in Canada for people that got a vector vaccine in Europe and other places in the world. And so, you know, it's been shown to be safe. It's shown to be really effective for those populations who had mixed. And so there shouldn't be any hesitation to get a third dose of an mRNA vaccine.
Dr. Chagla, this has been excellent as usual. Thank you so much.
No problem. All the best.